In recently published manuscript entitled Aging Dysregulates D and E series resolvins to modulate cardiosplenic and cardiorenal network following myocardial infarction, we defined the role of fatty acid derived molecules in heart failure pathology with major emphasis on resolution of inflammation. Traditionally, we know that grandkids or younger animals heals faster than grandma or aging animals. Age-related multi-organ inflammation is the primary risk factor in aging, along with many other risk factors such as obesity, hyperlipidemia, insulin resistance, and diabetes. In this published research article, we have provided the possible cause of overactive inflammation. Leukocyte phenotype is the critical factor for acute inflammation and inflammation repair. The key question answered here: when and how it turns overactive in response to myocardial infarction in heart failure pathology. Our study design is unique. We used aging animals that were fed with a transnational amount of fat-enriched diet and then surgically induced myocardial infarction. In disease trigger like myocardial infarction and stroke, the spleen leukocytes mobilize to the infarct area for reparative mechanism. Here we precisely measured chemical milieu using quantitative mass spectrometry and determined the leukocyte phenotype using the flow cytometry. Aging leukocytes are sensitive to chemical milieu that determines the phenotypes. Here we focused on the professional phagocytic leukocytes like neutrophil and macrophages that alter the phenotype depending on the lipidome around the leukocytes and the lipid processing capacity of lipoxygenase enzymes, mainly in aging. Excess influx of N6 fatty acids in aging downregulates the lipoxygenase enzymes, thereby reduce generation of D and E series resolving molecules that are essential for healing mechanism. Simultaneously, this MI-induced acute innate response aggravates renal inflammation, particularly in aging mice. Therefore, excess influx of fatty acids alters the initial resolving responses that are mainly generated from essential and conditional fatty acids to form number of immunoresolvins that dysregulate the inflammation not only at the site of infarcted area but also in cardiosplenic and cardiorenal network. Thus, presented report provides comprehensive systems biology approach to investigate heart failure pathology following myocardial infarction. Presented novel work is provided the foundation to define the balance of pro-inflammatory and pro-resolving molecules in the acute and resolving responses to treat heart failure patients. Future work with major focus on restoration of immunoresolvins will allow us to control multidimensional pathology in aging. This work was supported by National Institutes of Health K99R00 Independence Pathway Award from National Center for Complementary and Alternative Medicine, now renamed as the National Center for Complementary and Integrative Health. Thank you.